All right, everyone, we're going to go ahead and begin. People are signing on right now, going through the sign up process. Again, I'm Andre Bailey. I am the CEO and founder of Project Opioid. And Project Opioid, if you are unaware of our work and you're just getting to know us, because we have leaders on this webinar from around Central Florida, Jacksonville, Miami, West Palm Beach, Tampa, St. Pete, Fort Lauderdale, all around Florida. We have leaders joining us today to talk about the 2021 legislative session, how COVID-19 is going to impact that legislative session, and how we need to be looking at leaders on how to work within the confines of this year's incredibly challenging circumstances with COVID-19, but still make an impact on this important overdose crisis. So welcome, welcome, welcome. I want to also just mention to you a couple housekeeping notes. Number one, if you want to adjust in Zoom, see the presenter in a bigger screen, see the PowerPoint in a smaller screen, vice versa, those settings belong to you. So just go into your Zoom and you can change around the settings if you'd like and see the PowerPoint and presenters in different sizes.
Corner of the thumbnail.
All right, click the corner of the thumbnail and it'll help you do that. So we are not going to adjust those settings for you. We're going to let you do those. And also just please note that if you have questions, we have leaders from Project Opioid. Throw your questions in the chat box. You can start throwing questions in right now and we'll get to those questions promptly. Let me get this PowerPoint working here and we will get going immediately. Again, today's topic, the COVID-19 overdose crisis, how it's affecting the 2021 legislative session. Let me talk to you about who's going to be our presenters today. That's me, you know me. Again, the chat box, email, you can send us questions. And all right, first, our two guest speakers. We are so excited to have Representative Colleen Burton, Florida House of Representatives, District 40. She is such a powerhouse in the Florida legislature, working on some very, very important bills this session and helping lead our legislative process. So we're so excited to have her on. We're going to hear from her in just a minute. We also have Dean Cannon, President and CEO, Chair of Government Affairs for Gray Robinson. So excited to have him on. Those are our two guest speakers. Also, we have today, whoa. All right, hold on, hold on, our team is going back. Sorry about that, everyone. We got to have at least one technical glitch. And let me go back to our, here we go. Here's our presenters and panelists. Robert Stewart Jr., lobbyist, Gray Robinson, Chris Carmody, lobbyist, attorney Gray Robinson. So excited to have them. They're going to be talking about specific bills they have went through with some of our leaders and compiled some bills, 8 to 10 bills that are up and running right now, have been filed that they think are going to be pertinent to the mental health crisis, the overdose crisis. We also have our two co-chairs of this legislative committee for Project Opioid, Bob Cortez, who is now with the Seminole County Sheriff's Office, and Brad Richmond. They're going to be chiming in as well. And okay, so as we get started, we're diving in here. If you have questions, throw them in the chat box. As we get started, let me go through one more time the data on overdoses in Florida that we released in December of last year. Dr. Kendall Ward is on. Please put the link to the overall report in the chat box right now so people can have it. But I want to quickly just go through and show you again the overdose crisis that unfolded and is continuing to unfold in Florida. This is brand new data that we received from the Department of Health. And looking at this one chart again, 2018, we all knew overdoses were at an incredible, epidemic level in 2018. 2019, our hope is that they're going to go down. The data that came out roughly 6 months ago shows overdoses up again, the gray line in 2019. But everyone look at the two red lines. The first red line being the finalized numbers for 2020 from the Department of Health. The red broken line being the projected Department of Health numbers. Again, just stressing to you, there's this lag time between the coroner's offices and there's a process to certify overdose deaths. So the dotted line is where the Department of Health, and they stake their butt on that dotted line. Trust me, they're not putting out some kind of media hyped projection. That their projection is going to be right as rain. It is every single time they put it out. So if you look at the red lines, it shows that overdose deaths in Florida nearly doubled during the quarantine months of the pandemic. We reopened Florida in June and July, but the numbers continue to stay at levels in counties around Florida, in Central Florida, Tampa, South Florida, Jacksonville. They continue to stay at increases that were anywhere from 30 to 80 to 90% per county. This is unprecedented. And I just want to say this to all of the leaders out there. If there was not a COVID-19 pandemic, this would be the top story every day in every community in Florida and around America. We've never in the history of our union, we've never in the history of our state seen anything like this. And we believe the mental health crisis that COVID-19 brought just magnified the opioid crisis that already existed, and fentanyl is driving these deaths. So we have an absolute crisis. And that's why it's so important in this legislative session that we're looking to deal with it. Matt, give me my clicker, buddy. It's not working.
All right.
So, all right, perfect. Let me also just state that we have looked at data that came out in December, and it's important to note that although millennials make up only 25% of the state's population, they make up 50% of the overdose deaths that we're seeing in 2020. So it's massively disproportionate by age. And guys, if you take COVID-19 and the mental anguish, lockdowns, shutdowns, economic unemployment challenges, if you take COVID-19 at face value, it's very fair to say that COVID-19, the virus, kills people 45, 55, 65, 75 and up. But the mental COVID-19 anguish crisis and overdose crisis is killing young people in disproportionate numbers. So young people are dying. It's also important to note that if you look at all drug overdoses by race, you're seeing a disproportionate amount of deaths by race. So you see the highest percentage of increase in overall deaths was in the Black community during the quarantine months, March, April, May, June, and those deaths reached over 111% increase. So we want to also really look at underserved communities, vulnerable communities, to look at the Black, Latino community, poorer communities, and look at how we can get more resources to them. And so that's the data, and that's why we're here talking about leaders needing to work together to save lives. So how are we going to do that in the 2021 legislative session? So it is my privilege to introduce right now Dean Cannon. Dean, can you hear me okay? Well, to make sure you can hear me.
Loud and clear. Can you hear me?
Perfect. Technology is amazing, isn't it, Dean? Look at that.
Exactly right.
So Dean, President and CEO, Chair of Government Affairs, Gray Robinson, he has just been such an important leader to this state on so many different levels for years. Dean, talk to us. Thank you for being our guest, first of all, and talk to us about what you're seeing in the 2021 legislative session. What's important? What's going on right now?
Got you. First, thank you, Andre, for allowing us, part of the Gray Robinson team, to be part of this presentation and for convening this group. As you and I have talked about, I've had family members impacted by opioid addiction, and it's an issue I care personally about, as well as a matter of statewide policy. It's of great public importance. And in just a few minutes, I'm going to introduce my good friend, Representative Colleen Burton, to elaborate on some of the specifics of session. But I want to set the table from a high level of what the legislature is dealing with as we go in. And the two dominant issues, of course, will be COVID and the budget. The Constitution requires the legislature to pass a budget every year. And in a year like this, where we are in a global economic recession induced by the pandemic, the budget and the lack of funds will put a lot of pressure on the legislators as they craft a budget. And of course, then the policy issue of how do we deal with this literally once in our lifetime, hopefully, level of global pandemic. Right now, every year, the Revenue Estimating Committee is a joint effort by the executive branch and the legislative branch to estimate the revenues that the state will have to spend in the upcoming session. The best estimate we have right now is a $2 to $3 billion shortfall for the 2021-22 session. And to give you an idea of that magnitude, we haven't had a shortfall that big since I was speaker, which was 10 years ago. And at the time, as we came out of the 2008 recession and the federal stimulus money ran out, we had about a $3 billion shortfall. And it puts a lot of pressure, obviously, on the legislators who have to first meet the required expenses or the expenses that have federal ties to them. Healthcare money from the federal government that we get back has certain requirements that it can only be spent in certain ways, and that ties the hands of the legislature as they deal with it. Same thing in transportation and certain other areas. But it's a significant shortfall, and that can impact spending in a couple of different ways. It certainly compels the legislators to do what we did back in 2011, 2012, which is the same thing that families and businesses do. When you have less revenues and more expenses than you have revenues, the first thing you got to do is prioritize the essentials. Healthcare, transportation, public safety, those always dominate and should dominate the legislative budget priority list, and they will here. And Representative Burton, who's chair of the HHS committee, she can comment on how that's going to spin down into the healthcare world. But healthcare generally, public safety generally, and transportation generally, along with education, will all be prioritized, but they'll have to make reductions even in those areas. Back in 2011, 2012, we even had to make cuts in those critical areas because when you're short a couple of $1 billion, you have no choice. Many people may know or may not, the Florida Constitution prohibits the state from deficit spending. So we can't borrow against the future. That's actually a good feature. It keeps our state's economy strong, keeps our bond rating high, but it does put a lot of pressure on the legislature as the appropriating branch as they make those tough decisions. The question that then drives part of those policy decisions that the legislature will deal with include where do they get additional revenue or potential additional sources of revenue to help offset the shortfall. And because funding for opioids is going to be competing, for opioid treatment is going to be competing with all of the other worthy healthcare expenditures, the Republican-led legislature, which is reluctant typically to ever raise taxes, will probably be open to different revenue sources. And I think of things like a potential renewed gaming compact with the Seminole Indians. That's a potential revenue source which is recognized in the law, has the potential to add additional revenue, and it may or may not be complicated or supplemented by the possibility of online gaming, sports betting, things like that. As we've seen the cultural impact of COVID and a big enhancement in online events versus in-person sporting events and other things like that. A lot of the folks we're talking to speculate that that may elevate an interest in some of the online revenue sources. Probably the biggest potential one also is online sales tax collection, the so-called Wayfair fix. In Florida, if you purchase something in Florida, we should pay sales tax, but there have been various degrees of enforcement and mechanisms to collect that tax. If, for example, the legislature were to approve both the gaming compact and online sales tax, that could potentially generate maybe in excess of $1 billion of extra revenue that they could spend in the budget. Now, that you would think then, so why doesn't it happen? Well, it doesn't happen because there are very complicated and politically sensitive issues invoked by everything from gaming to tax collection. So it won't be easy, but at the very least, you have both appropriating committees in the House and the Senate focused on it, looking at it, and trying to figure out how to deal with it.
Dean, let me ask you this really quickly. Is it also possible that federal stimulus dollars could impact the budget? We're unaware that of how that's going to wind up. Is that also something that you're referring to?
Absolutely. And there's actually two components to the federal money. There is the first tranche of CARES Act and federal relief that has been already distributed to the states. And depending on who you speak with, Most of that has been either allocated or anticipated to be allocated, but not necessarily released. How much of that gets added to the revenue estimate can definitely supplement the potential revenues. And then, of course, now the possibility of a second tranche of federal money to help stimulate the economy, get states going again. Those two things together could be a big boon to our budget writers in the Florida legislature. One of the good things about the federal government's response to this crisis is it was more rapid and, frankly, apparently more effective than the recovery package they did back in 2008. Many of you may remember the Troubled Asset Recovery Program took years to distribute and was not very, it was sort of encumbered by a lot of bureaucracy. Congress has done a good job, and it looks like the Biden administration will carry that forward of recognizing, this was a flash recession and it needs an immediate, aggressive, stimulating response. And it looks like the federal government has both done that and is going to continue to do that. So that can definitely help us a lot. The other policy standpoint that may implicate and or complicate the legislative debates will be COVID liability. I don't think anyone doubts that they're going to pass COVID liability reforms. In fact, I think that'll happen early in session. But what we don't know is how will the courts treat those reforms when they are invariably tested by those who may be against liability relief. We certainly have a different Supreme Court today than we had just 4 or 5 years ago. So that favorable, potentially more favorable to liability protection Supreme Court might add to the reforms, which will then pull some of the pressure off the healthcare system and then hopefully have the positive effect of freeing up potentially more revenues in the long haul. So we can expect a lot of complexity. Obviously, in the middle of all that, there will be normal bills going on too, because our session only meets every spring for 60 days. And so expect a lot to get done, I think, in the early weeks, and then it always sort of like a good NBA game. It comes down to the last couple of minutes to the game, metaphorically speaking, when that budget will be written. But I'll stop there because that is a global standpoint. Someone who is far more qualified than I am to comment on the details of where we're going is my good friend, Representative Colleen Burton. She and I both hail originally from Polk County, and she chairs the HHS committee. So it's my privilege now to introduce her and turn it over to her. Colleen?
Representative Burton, can you hear us? Just press the mute.
Now I'm unmuted.
Perfect.
Can you hear me?
We can hear you perfectly. It's so good to have you on.
Okay. Thank you. And good morning, everybody. Speaker Cannon, thanks for that nice actually setup and introduction. I was thinking, oh, I should have paper here to write notes on everything he's talking about. And just real quickly, I want to talk about the budget because the budget is big issue, as the speaker said. One of the questions that he answered preemptively there has to do with the federal money, another tranche of federal money, or that which we already know is in the system. One of the things you have to keep in mind is that money, I would think that in the legislature, we will be reluctant to use new money that is not recurring, right? It's a one-time money source to pay for recurring expenses. Because then what happens is then you set yourself up for next session, next year, now the money's gone, then what do you do? So that unfortunately is part of what we have to keep in mind as well. I do believe if there are funds available, the government to this point has used a lot of that money, some of the money that's come in to pay for actual expenses related to COVID. Those are the types of expenses that are mounting across the state. We know that's probably a very appropriate use of those funds. So I'll tie a little note of a string around that topic right now. That's where that is. But it overrides everything. And quite frankly, when you think about the opioid crisis in Florida, and I'm going to talk about your graph that you showed in a minute too, a lot of it has to do with funding, right? It has to do with programs that are out in communities across our state. Some of them, many of them are not just paid for via state funds, but I think my advice to anybody looking for money from the legislature right now is to, when you have an opportunity to work your bills, make sure that you're able to show that they have statewide impact, because we know they do. But that's a good, I always ask that question. And a few years ago, when I was on healthcare appropriations, we actually did an exercise. That's one of the things we did. We looked at all the projects that came through and said, how does this have statewide impact? So you clearly should be able to show that. The graph is dramatic and sad, and I would use that everywhere that you can. Question about the graph I wish I could stay on for your whole presentation today, but I've got to hit the road and go home when we hang up, is, I actually just read this morning that suicides across the country, suicides have gone down. So I'd like to see what correlation there is between what we're showing. I mean, I know all opioid overdoses are not suicide, but I'd like to see if there's a correlation between that, because suicide prevention is something that we've talked a lot about in the Florida House. And I think we need to continue to talk about that, because it's a terrible problem, along with the opioid crisis that we've seen escalate here in the state. Another point that you made in your presentation, it was a great tee up for me, has to do with healthcare inequities and disparities potentially across our state. And we actually had a panel just recently in HHS, and our topic generally was maternal health, maternal mortality, and infant mortality. But a big connection and a lot of the conversation was around health disparities. So that we know that, for example, I've learned a lot just in a short amount of time on this issue. We know that in every community, and you have caregivers, in your case, you have folks within the opioid prevention programs. We're out there messaging, we're working hard with everybody. The same message doesn't work across every community, right? Some communities need to hear things differently, and we need to really take that to heart in everything that we do when we try to reach out to communities all across our state. And for example, your demographic, young people, you're not going to speak to a group of 20 to 30 something year olds using the same language that you're going to speak to me, or perhaps author Dean Cannon. He's not as old as me, but he's, to us, that you're going to speak to us in. So those are things I don't know that we've given a lot of consideration to. Certainly not the racial, minority, community, neighborhood component of this, about how important that really, really is. I mean, we've seen Governor DeSantis direct COVID vaccine sites to churches in communities. That's huge. That's huge, because folks are reluctant to get the vaccine, and we know that if we can speak to them from their communities, they will hear the message more easily. So that's part of what I think you can and probably are doing in the good work that you're doing across the state, but it's being elevated in our discussions in the Florida House. Speaker Cannon also mentioned COVID liability, which we'll be talking about next week in HHS. It's a PCB, meaning it's a committee bill, meaning it's important. Let's just put it out there for that. And I am actually carrying that bill. I think it's very important that we protect healthcare providers all across this state from unnecessary litigation when they were working hard, putting their lives on the line, and doing everything they knew to do to protect individuals walking through their doors and patients that they cared for. On the other hand, we do know that, in our system, in our society, people, believe that they should, in the event of real gross negligence, that they should have the opportunity to bring a case, and that is provided for in the event that happens. But the protection that we can provide to healthcare providers all across the state is important. We want them to continue to do their work without having the shadow of millions of dollars in lawsuits potentially hanging over their heads. To the speaker's point, sadly, a lot of times when we propose new legislation like this, it gets challenged in the courts, and it will happen. Somebody will push against it. So we'll work very hard with our Senate partners to make sure we craft legislation for the business sector, non-healthcare related, and then separately for healthcare providers across the state, so that we make sure that they are protected. And that, there's that. And to the speaker's point, we have a lot of the usual bills, some bills that have come back year after year that are beginning to come back and come into our, I'll get on my schedule potentially. We have had a few, it comes to mental health. I will tell you, we do have some proposals related to mental health and telemedicine. So I'm interested to get some feedback from the community, from those of you who've used telemedicine, even in the practice of what you're trying to do, to see if you've had any hiccups along the way, if there's any barriers that we can help remove so that the work that people are trying to do in health, we have one of the best statutes in the country. Actually, we have the best statute in the country. It's wide open, but we know it's been widely used and widely utilized during the pandemic. I want to see that continue. I want it to see to be a great avenue for people to touch those who care for them. So
I'm sorry, keep going.
I'm going to wrap up and see if anybody has any questions for me while I'm on with you.
We do have one question for you, and I know you only have like 3 minutes left, and we are so thankful for your participation. I'll give you a quick comment, and then we have a question. Just know this, Representative Burton, Project Opioid, and all of our business, faith, philanthropic leaders, we are 100% on board with telemedicine, telebehavioral health. We have seen that be such an important part of the pandemic relief, and there's a lot of possibilities there that can be life-saving and can save money on the budget. So just a little side note, we are all in favor of expansion of telehealth, telemedicine, telebehavioral health, and so side note there. But question from one of our guests, what about the opioid settlements, Purdue Pharma, McKinsey, and others? How could these monies be used for opioid treatment by the state? What are your thoughts on that?
That's a good point, and quite frankly, for me to comment appropriately to that question, I'd have to look at the settlement itself to see if there are some perhaps parameters that were written into the settlement payment. I do know that our Attorney General continues to work on that issue because we actually have a bill that's in the process right now to where she would like to continue to have access to information for prescriptions that have been written across the state related to opioids so that she can show that connection. So at this point in time, really, to tell you the truth, since I haven't read the policy, I'm going to guess, or excuse me, I haven't read the decision. It would really be inappropriate for me to comment too much on that. Now, having said that, as an everyday citizen out there here in Florida, just off the top of my head, doesn't it make sense that if you have a settlement and you have the settlement because of dangers deaths that were caused by opioid abuse and use, it feels appropriate at first blush. It feels appropriate that we should look at spending that money on making sure that we're, quite frankly, that we attack the crisis that we're currently in right now. But as I said, since I haven't seen the decision on that, you haven't actually read it, it's kind of hard for me to comment on that.
And Representative Burton, we're going to get you out of here in 60 seconds, but I'll go back to something you said when you started, and that is we need to be very cognizant of reoccurring costs versus one-time or short-term investments, that those are going to be treated very differently. So as advocates are out there trying to find solutions to this COVID-19 fueled mental health crisis, overdose crisis, they've got to be cognizant of, are they pushing for a permanent funding, a solution that needs permanent funding or short-term funding? That's going to be important, right?
Absolutely. And my advice to anybody who is currently working on or trying to make sure that we continue something that is in recurring funds already, go in, ask for it to be maintained. Just you should do that. You should ask for it to be maintained, and then hope that, quite frankly, that we don't see dramatic cuts. Speaker Cannon mentioned, sadly, healthcare is one of the, a big bite of the apple. We are just huge in general revenue funds, which is the part of the budget that the House and the Senate actually appropriate. And we are going to have to make some reductions. It's going to be very, very hard. Again, I cannot emphasize to you enough, when you are advocating for funding, make sure that you impress upon whomever you're speaking to that the funding you're asking for, and find a statewide impact for it. That's a good part of your story, because it's the truth. It's the truth. And quite frankly, the truth is on your side. Representative
Colleen Burton, thank you so much for joining us. You're so busy running important legislative priorities right now in Tallahassee. Thank you for joining us, and we'll be back in touch with you and keep you updated on our work. Thank you so much again for your time today.
Look forward to talking to, I know there's many of you on the call. Look forward to talking to some of you between now and the end of session. Please stay in touch. Thank you.
Thanks so much. Dean, let me go back to you for just a second. Just any kind of follow-up thoughts there?
Well, I'll say this. First, we're lucky to have people like Colleen Burton in the legislature, because most until you see the legislative process, I think we tend to picture, politicians talking into microphones on the floor, but so much of the work is the policy analysis, the digging into the weeds, the researching, the finding of the solutions. And we really do have, in addition to Representative Burton, a whole host of legislators who recognize the importance of all healthcare issues in particular, but certainly treatment and recovery for opioid addiction. And the second thought would be part of that chart that you showed at the beginning, with the potential increase in both addiction behavior, the tremendous strain that COVID has placed literally on the entire world of additional mental health strain. We know that's impacted all of us negatively. It's impacted me negatively. I don't think there's anyone who has not been adversely impacted. And so I hope those forces combine to help us elevate opioid addiction treatment and recovery as part of the solution. So that's my thoughts. Andre, if it's appropriate, should I turn it over now to Chris and Robert to dig in on some of the details we've talked about, or how do you want to proceed?
Dean, I'm going to turn it over to one of our staff members who's going to introduce them. Lisa Nason, can you hear me? Are you on? I always like to check the technology here.
Yes, good morning. Good morning. Can you hear me?
I can.
Oh, good morning, Andre and all. Great presentation from Representative Burton and Speaker Cannon. Thank you both so much. And now, yes, it is my pleasure to introduce more of the Gray Robinson team, Chris Carmody and Robert Stewart Jr. As Andre mentioned, Chris and Robert are going to walk us through some of the most significant pieces of pending legislation. As we know, both Chris and Robert are among the most knowledgeable, most trusted lobbyists and advocates in the entire state. We're so pleased that they're able to join us this morning, and we look forward to hearing an update on a number of bills and also how we can support in their efforts. So Robert, Chris, I'll turn it over to you now.
Thank you, Lisa. Can we bring you on the road with us? We need that kind of hype person everywhere we go.
Energy, yeah.
And good morning to everyone else. A great presentation so far. Dean did a great job giving an overview of where we are with legislative session coming up less than a month away. And Chair Burton gave great insight, and kudos to this group. She doesn't have time to do a lot of these presentations, but when she heard who's going to be on this webinar today, she was excited to join because she knows all the good work Andre and the team's been doing.
Robert and Chris, let me just chime in and tell you that you tell me to advance your slides and I'll do it. I got the clicker right in my hand here. So
perfect. Well, Robert and I always like our slide of our pictures up first and foremost.
Yes, I know. So I'm gonna leave it up 90% of the time. But.
No, we'll jump to a slide in a second. So I think the next one we'll talk a little bit about the bills in progress. So as of this morning, there are 12 bills filed in the legislative process, with more to come. You heard Chair Burton mention one regarding General Moody's taking an interest with the opioid settlements. And then as well, Robert's going to touch on one that I know Senator Boyd and Representative Plakin's working on as well, that we've been playing an active role in. But there are 12 so far, and a lot of those have companion bills, so it's really boiled down to about 5 to 6 issues. And we'll
Chris, let me just chime in one more time because I want to make sure everyone knows out there, because I've just got some questions in the chat box. This is what's happening right now. Robert and Chris, with some help from Bob Cortez and some others, have scanned all the bills. Robert and Chris, there's hundreds of bills that have been filed. Yep. And they've scanned through all those bills. And what they want to do right now is highlight bills that they think, and this is my term, not theirs, but that they think have legs to them, that there's so many bills filed, but they have expertise in knowing what bills related to mental health, the overdose crisis, opioids, look like they have a chance to cross the finish line. So we're not necessarily advocating for or against any of these bills, but they think these bills have a lot of life to them. And if you're advocating for mental health, opioids, overdose, behavioral health, substance use and abuse, you need to know about these bills. So that's what we're doing right now. I just want to make sure Chris and Robert, everyone knew that.
No, great overview. And so, and some of the bills you're going to see, and then I'll kick it over to Robert, who will do the first one, is, they deal with veteran mental health, veteran treatment, policing our providers and dealing with regulations on our providers. As some of you know, that can be tricky. And then as well, just in general, maybe enhancing abilities for folks like peer specialists to get in the game and assist even more so than they can now. So all of those are very relevant. We know all of you, based on your backgrounds, have different interests on these. So I don't know if that's the next slide. Maybe that's a general one, or Robert. Yeah, so slide after that, we'll kick it over to Robert to talk about the first one.
Yeah, thank you, Chris and Andre and all of you for joining us today. It's great to be with you. Real pleasure. And Lisa, yeah, I'll second Chris's recommendation that we bring you with us everywhere we go. That was quite a wonderful introduction and great to see you. And I'm grateful for your friendship. Yeah, the first one worth mentioning is a bill by Senator Keith Perry and Representative Scott Plake. And this bill was filed last year, didn't quite make it to the finish line, but not for, from what I can tell, any reason other than timing. The bill in the Senate is already headed for its last committee of reference next week, and then it'll be ready for the Senate floor. The House bill by Plakem was just passed, or excuse me, just filed last week, so it's still waiting on its committee references and to get moving. But what this does is really an informational or an educational piece that authorizes healthcare practitioners to provide educational pamphlets to patients in an electronic format instead of a paper format, as they look at non-opioid alternatives. So just another kind of an educational piece, sort of a belts and suspenders type issue that we expect to have legs, both because it did last year a little bit and also because of who those sponsors are and some of the focus that's on these issues. That's the first bill. You can go to the next slide, Andre.
And as I mentioned, the provider policing and dealing with the regulations. So there's some legislation out there. Senate Bill 804 by Gail Harrell, who's out of South Florida area, Port St. Lucie County area. And then House Bill 319 by Representative Caruso, also from similar area. This legislation, a couple things, provides criminal penalties for false representations or omissions in your licensure application. Obviously, the way we best deal with this problem is making sure that people in the solution area are properly licensed in there and not misrepresenting. And so it gives the Department of Children and Families a little more teeth in what they can do as far as enforcing fines, suspending licenses, or what have you. And then on the other side of it, it talks about some of the regulations that are preventing some of our good providers. So you'll see one of those bullets prohibits reclassification of recovery residences and building code. That's something on those various task force and input they've taken, and they've realized that, you know, setting up these recovery houses are not easy because they're not popular places or homes to put in any kind of neighborhood, as you all know, based on some of the clients that are coming through there. And so building codes get changed or zonings get changed or what have you. So this is one effort to help protect those houses and not let them get zoned or building coded out. And then as well, little things like requiring extra fire sprinklers being installed in some of these, not making that requirement on some of these homes. Again, trying to make it less barriers for entry into this recovery home process. Both bills were filed in February, so fairly recent. So they haven't had their first committee hearing yet. And it's probably worth noting before we get into the rest of these bills is this session, without a doubt, is unlike any we've ever seen with the budget circumstances. Those are similar, like Dean said, to 10 years ago and others. But with COVID, it's changed the protocols. They're not having a lot of meetings in person. But part of it is they've staggered their committee meetings. They've cut back their committee meetings. So we're going to be March 2nd, the first day of session, with probably half to no more than 60% of what normally would have been the committee meeting time going into session, which means bills that would normally be through one or two committees going into session wouldn't have even been heard yet. So this is probably going to be a low number of bills passed this session, and the bills that do pass are going to take a lot of effort, Herculean effort, if you will, to get them across the finish line, unless they're speaker or president priorities. So pay attention to that. So if you see bills you're interested in and this group wants to engage on, keep that in mind, that we'll have to put a lot of effort behind those.
Chris, let me just ask you, because I'm being asked right now, is there a website that someone can go to where they can type in these bills and see them in their totality?
Yeah, there is, Andre. The Florida House of Representatives website and the Florida Senate website are both pretty user-friendly and really good places where, particularly with these bill numbers, you can type them in and see both the language of the bills, the status of them, who the sponsors is, all that stuff. So it's www.flsenate.gov is the Senate website, and www.myfloridahouse.gov is the House website.
Yeah, because I think it's important, again, for us to reiterate, we are not for or against at this moment any of these bills. What we are trying to tell you guys out there is these bills are our legislative experts, and Gray Robinson is as good as they get, tell us that these have a lot of life to them. I will say to my Palm Beach County partners, I know Palm Beach I need to read this bill myself. It's brand new. It hasn't even gone to a committee, but SB 804 and HB 319, Palm Beach did a lot of work to put recovery houses in a position where they had to register. So this is obviously going the other direction. Just something to note, and many will have questions about this bill. So let's dive in over the next few weeks and figure out how it could make positive or negative impact.
And Andre, you can go to the next slide. The next one is really focusing on veterans, and Florida has made it a point over the last several years to try to become, from a policy perspective, from a budgetary perspective, the most friendly veteran state in the union, and I think we're well on our way to being there. And this sort of fits into that. There's this crisis that we're in right now, and so many others that veterans have found themselves in. Have Florida really focusing on what we can do to improve the lives of our veterans as they come back to Florida. This is one of those, sponsored by Representative Zika out of Tampa, and again, Senator Harrell. This bill would have the Department of Veterans Affairs establish the Florida Veterans Care Coordination Program, which, among other things, would be focused on mental health and substance abuse issues that our veterans sadly sometimes find themselves in. Also involved in this bill, and I think worth mentioning, the Senate bill has passed the bill. I'll say this first. The Senate has passed the bill out of its first committee of reference, the Military and Veterans Affairs Committee. It's now waiting on its second committee. The House is up for the first time. This bill is up in the House the first time in the Local Administration and Veterans Affairs Committee on the 16th. That's, I think, next Tuesday, if my dates are right. But also involved in this bill behind the scenes is State Senator Danny Burgess. Danny Burgess was this Governor DeSantis's first Secretary of the Department of Veterans Affairs, veteran himself, and now a state senator, and somebody who is on anything veteran related is going to be a leading voice for the Senate and for the state, as somebody who knows those issues better than just about anybody. So that's a veteran bill worth keeping an eye on, and one that, like Chris said, that there are not going to be a lot of bills that pass this year for a whole host of reasons. This is one that's already well on its way, at least as of today. You go to the next slide, Andre.
So mental health and substance use disorders. There's bills, Senate Bill 130 by Darrell Rousson and House Bill 83 by Representative Hart. This one, I saw a question earlier in the chat from, I believe, Karen, that talked about peer specialists. This bill's for you to pay attention to. It provides, obviously, that peer specialists are an essential element of the coordinated care system. Of the, I think, 9 pages of this bill, 3 or 4 are dedicated to new language that reduces the background screening requirements. So it's no longer level 2, recognizing that many of these folks wouldn't otherwise qualify for that level 2, or pass it rather. And then puts more language into the Department of Children and Families training program to really encourage utilizing peer specialists in helping folks with opioid abuse addiction. So this is a bill that, while, again, as you'll see at the bottom, it's been filed in December and hasn't had a first committee hearing. That's, the fact that it's been filed since December is not a good sign that it hasn't had a hearing yet. But as I said a few slides ago, a lot of bills, including those who are filed by ranking members in both chambers, haven't had their hearings yet. So it's not necessarily an indication, but if it's something we're interested in, something to pay attention to.
Chris and Robert, I also will just mention that our research, Project Opioids research, shows we did a deep dive into some of the statewide mental health solutions in Indiana. We've got a new partner, Solutionize, out of Indiana. They say, this is their comment to us, that growing your peer support network is one of the most important aspects of this overdose mental health crisis. So just important kind of note that the feedback we've gotten from national partners is that us progressing down this road as a state is going to be an important part of our solution over the next few years.
And so perhaps before we kick it over to Robert for the next slide, probably buried the lead there. Rousson, the senator there that's referenced, he has been very open with the challenges he had early on in his life with substance abuse. And so he's become a bit of an authority in both chambers. When he was in the House, now he's in the Senate on this topic. And so he speaks from a place of knowledge, and with his unfortunate background in that regard, but that he's overcome. So but you're right, Andre, this is something that they're taking seriously. I know he's pushing for. as you could see, even going so far as to encourage Medicaid managed care programs to use peer specialists in the recovery services. So it's an exciting bill, one that hopefully will get moving.
One more for me to mention is a Controlled Substances Offenses Bill. This is one by Representative Plakin, filed a good bit ago, does not yet have a Senate sponsor, and it is still waiting on its first committee in the House. But the reason I mention it is not because I necessarily think it's going to pass. It may, it may not. It's probably a little bit too early to tell with this particular one. But this is one that really focuses on revising requirements in the law for unlawful distribution of controlled substances, including opioids, and also providing for a distributor or a salesperson or a seller of these products to potentially have culpable negligence when the mixture or the substance is a proximate cause in a contributing injury or overdose. So it's a bill that's going to increase penalties. It's going to increase the policing of these things, increase the regulatory structure around them. And one that I think is definitely going to be discussed this year, even if it may not make it all the way to the finish line, given some of the pressures it's going to have. But one worth mentioning, and Scott Plakin is a member of our delegation here in Central Florida, representing Seminole County, and somebody who over the years in the legislature has become very, you've seen his name a couple of times, has become very passionate about these things. There will be other offenses type bills that are going to come up between now and the time that session is started. This is, I think, the first of several that we can expect, because that is one of the places where the legislature, I expect, is going to spend some of their time in terms of what should we do about bad actors in this space. And so be on the lookout for those as well.
Let me just say to all those who are attending, we'll send you these slides. We'll make sure you have these bills. I encourage you to reach out to some of these members of the House and Senate and their staff. And if you're for or against them, if you want more information, reach out to these leaders, because if you're for, again, or against, or you think something should change, they need to hear from you and hear your voice. So don't feel like we're not giving you this information so we can be your conduit to advocacy. You're the best advocate for what you believe in, and that's why we're doing this webinar.
And finally, as far as on bills that we're going to be covering, and before we get into some Q&A and some other topics, is you've got substance abuse penalties and treatment by Senator Book, 828, and then Representative Manny, 405. This legislation, there's a lot of bullet points. The best way to sum it up is this is going to be a major overhaul of the Baker and Marchman Acts, which I believe Baker's turning 50, that act. And part of it is there's this feeling that you get committed, so to speak, on one of those acts, and there's no continuum of care established for someone that's coming through there. Because as we know, a lot of folks that get Baker Act or what have you, a lot of that has to do with some substance abuse issues and what pulls them in. So Senator Book, who's been very outspoken over the years on this particular topic since she joined the Senate, is really pushing this through. It's got a committee hearing next week in Children, Families, and Elder Affairs. And so my expectation is the House bill will start to move as well. But the whole idea is it's going to overhaul the Baker Act and Marchman Acts to look at it of, are we providing enough services to those on the way out, not just on the way in. And so pay attention to that. It's like, as you can see, there's a lot of, some of it's just basic, like, hey, let's update the bill, right? There's better ways of just doing this with new technology, but there's other things that just in generally are more important, like continuum of care and providing a plan and making sure that there's some oversight to help get that plan implemented. So that's an exciting bill. It is starting to move in the Senate.
Chris, let me mention something on this particular bill for all of those in attendance who you're not only working on the overdose crisis, but your group might also be working on homelessness. This is actually a bill that is going to be used by homeless advocates around Florida. Remember, guys, that Senator Book's father is Ron Book, who is, in my opinion, one of the most tenured advocates on homeless solutions in the work he's done in Miami in Florida history. The guy has done, in my opinion, incredible work in South Florida. So for those of you that deep dive into Senate Bill 828 and House Bill 405, This is looking to solve chronic homelessness along with substance use, abuse, and mental illness tied into it. But make no mistake, this is a bill targeting how communities can use the Merchant Act to and funding and their system to get chronic homeless people off the streets. I just want to throw that out there because of some other work we've done in the past on this issue.
Yeah, great comments, Andre. And as we go to kind of the last one, there is no slide for this. And Andre, I'm going to surprise you. You don't know I'm doing this, but the bill that I'm gonna actually hand off to my good friend Bob Cortez about, if there is one major opioid related policy bill that is coming, it's just not filed yet, and it's going to be by Representative Caruso and Senator Boyd. Representative Caruso served on the statewide task force. Bob Cortez, who's on with us today, was heavily involved both in that task force and in the workings of this bill. And I'm going to hand it off to him to give you a little bit of sense of what's coming. But if there's, like I said, if there's one comprehensive task force driven policy bill that's coming, it's this one. And we're just waiting on that to be filed. But Bob, please share a little bit from a top line, what we expect to be in that bill.
Thank you, Robert. Thank you, Chris, for a great job of presenting this. In our legislative committee that I chair with my good friend Brad Richmond, we work daily with Project Opioid and some of the members to try to craft legislation, or at least see what direction we can go to move things that are important to our community that would help us solve this epidemic that is affecting all of us. Of course, my Sheriff Lima, was the vice chair of the statewide task force. He served with both Senator Boyd and Representative Caruso, and Ashley Moody, our Attorney General, being the chair of the task force, which they met and brought up a lot of the issues and recommendations to move forward. So based on some of those recommendations, I've been working throughout the summer with Rep. Caruso to try to come up with some language for a bill. And we do have one that is right now in drafting. I was told yesterday that we should expect possibly before Friday to be filed. It deals with the access to Narcan. So as we do and work with here on Project Opioid, one of the key features that we do is obviously the distribution and access to Narcan, because we know that Narcan does save lives. And Florida Statute 381887 is the one that is crafted that is what we call the naloxone, the antagonist bill. And it does a lot of good things, and we believe that it has room for improvement. One of the things that we're working on is currently you can get Narcan from any pharmacy that has a non-patient specific statewide order. So let's say Walmart, you go to Walmart and you say, I want Narcan because I believe I have a son or daughter that may be using that. I'd like to have it at home. You could get it right now today at the pharmacy, and they would prescribe and dispense it to you. But the problem is that Walmart has to use their own doctor to be the one that prescribes it. Versus what we want to do, and North Carolina has this model, is that the state surgeon general would do a statewide standing order that all pharmacies can tie on to. So that's one of the changes. We also want to make sure that right now the statute says that law enforcement first responders are the ones that are authorized to possess and administer Narcan with immunity coverage. And for example, in our sheriff's office, we have a lot of civilian personnel, our child protective investigators, our probation officers, and others that cannot administer or possess Narcan because they're not covered under immunity. So we want to make sure that everyone that, if you have an organization that is out there that could administer and possess Narcan, that the immunity is covered, just like it is on the current law under the Good Samaritan law. Peer specialist was mentioned here by Robert as one of the bills that's being filed. We added a component on the peer specialist. Basically, we're just targeting the background check. We're bringing the level 2 down to just a regular background check on this bill alone. We don't want to make it too onerous. Representative Caruso is doing the co-dispensing portion of the bill, which is really good. The co-dispensing, currently, if you get the doctors prescribed you pain medication, opioids for an acute pain condition, they have to co-dispense with Narcan today. So they would add a drug disposal kit as part of the co-dispensing. So those folks that have some pills in their medicine cabinet and they want to get rid of it, this dispensing kit, you can get rid of it straight from your home without having to go to a law enforcement or some place that can dispose of the medicine for you. And then finally, the bill addresses the reporting. And it was one of the issues that was brought up in the task force. We have what's called statewide. The OD map is the overdose map that we use to try to target our hotspots of overdoses throughout the state. And it relies heavily on the reporting that comes through that. And the statute says that, for example, ambulances and medical personnel transport report those, but the hospitals and intensive cares and others are not required to report. And in some areas, we got some good reporting. Some areas, we have no reporting at all. And the Attorney General and the task force said, we need to make sure we get reporting from anywhere. So that bill is like I said, it's getting ready to get filed this week. The Senate sponsor will be Boyd. He has it in drafting. We expect it to get it moving. And once we get a bill number, we'll share that with you. And finally, I'll close with this. The job that we do in the legislative committee with Brad Richmond and others is very important because it's not just about filing bills. We're working right now with Rep. Duran, who was going to file an MAT bill, but we found out that some of the things that we can change doesn't need a bill. We can actually go through ACA and change some of these things administrative. So these are the things that we're working internally on the downside of how we can impact policy without having to actually file a bill. And there's ways of doing it. And we've got that direction to do it. So a lot of work. I want to thank everybody who has participated in this. We've got a lot of work to do. Plus, it's not just about passing the bill, but also trying to stop bad policy from happening too, which is a big important piece. We'll continue looking at that, and I look forward to continue working with all of you in the future. Thank you.
Thanks, Bob. We've got just a couple minutes left. I'm going to throw a few questions out to you three. The first question we have from our leadership is, where in the beep is the MAT bill? And I think, Bob, you just dived into that, but our leaders and leaders around the state, and even the Ashley Moody's, the Attorney General's task force, said MAT expansion is critical. We need to do a whole nother session on how, whatever your politics are aside, the Trump administration did an executive order really causing the X waiver, if you don't know what that is, look it up, to be molded to where MAT medications for those that are suffering with opioid addiction could be expanded. The Biden administration just came in last week and undid that. Again, all politics aside, the X waiver on a national level is a big deal. But Bob, Chris, Robert, where are we at with anything that could impact the expansion of medications, FDA approved medications that people can take if they're struggling with opioids? Don't all answer at once. I think, Bob, let me just throw this back to you, Bob. Are you saying that we might need to look at working with ACA? Is that one of our best roads there?
Yes. So one of the communications we had with Rep. Duran as we were trying to craft him to possibly do some draft language for an MAT bill, and based on the X waiver that was discussed here, well, my recommendations was to meet with the policy director over at Health and Human Service, Krista Kalamas, and he did. And Krista Kalamas gave him a whole list of recommendations, and many of the things that he mentioned in possibly drafting the bill, she said that's either already in place, it's already being worked on as we speak through ACA, and if not, we can work some of these things through ACA. The new Secretary of ACA, Simone Marsteller, is a good friend of all of us. We know her very well. She did a great job with Department of Juvenile Justice. I think she's going to be very interested and continue to work hand in hand with us to try to solve some of these MAT issues that can be resolved through either rule change or issues through ACA. And if not, then we can always come up and craft some language for an MAT bill.
Got it. Robert and Chris, with our last 60 seconds, we have some questions. If folks want to reach out to one of their representatives or someone in the state or in the House, what's the best way, just kind of for a group, an advocate, someone who doesn't know their way around Tallahassee, what's the best way for them to advocate this year, especially when a lot is shut down?
Great question, Andre, and I will highlight that this year is a little bit different in terms of the best way to advocate and the best way to connect with your state House and state Senate members. I will tell you, if there's been a bright side so far from my experience in the inability to get into the Capitol, the inability to have sort of in-person meetings with members, the inability to roam the Capitol on a daily basis when they're there for committee weeks or the legislative session. It's been that the members have found themselves without people dropping into their office with a little bit less to do, and they're being much more responsive, both their staff and the members themselves, because I think they sense the difficulty of the general public or the lobby corps or advocates for various issues and topics. They sense the inability to get to them, and so I think as a result, they are reflexively being even more communicative and accessible than they would otherwise, and most of them are always that way anyway, but even more so than they would always be. But phone calls, emails to offices, getting to know the staff, I would say is really important, and treating the staff, the legislative aides and the district secretaries well is always a great step towards getting to their bosses. But I would say there is nothing, and Chris, Bob, anybody else want to chime in here? There is nothing that beats a personal relationship with these legislators when you're either in Tallahassee or you're reaching out to them. So I would encourage you, figure out who you know that's a member of the House or Senate. These at the end of the day are citizen legislators. They come from our communities. They still work in our communities. They're only part-time in Tallahassee. Figure out a point of connection, a personal point of connection that you can leverage, and get after it, because they want to be helpful. They want to do the right thing, and nothing can be more impactful to their daily work up there than hearing from somebody that they know in their community.
Got it.
Yeah.
Go ahead. Go ahead, buddy.
I was going to say, Andre, the only thing I'd add to that is social media is where a lot of these members are very active, specifically in Twitter. And, you know, to the extent you are engaged on Twitter, if you're not trolling them, as I think the lingo is, they're usually pretty responsive, right? So if you've reached out to their office and their email and you can't get any response, a polite reach out on social media, which you know is going direct to these members. This isn't the president of the United States, or well, actually the old president did look at his Twitter all the time, but the new president probably doesn't monitor it daily. They're looking at their mentions and people who are messaging them directly. So that's one way to get to them. And then as well, not to volunteer our team for too much work, but if you're struggling to crack through, but you want to make contact, you know, feel free to, through Andre, get our information. We're always happy to help connect and do that, because as Robert said, they want to be responsive. And this is just a very odd session where folks who normally drive up to Tallahassee and go to the Hill and make their case, there's no access to do that. So it's different now, but we're always happy to help in that regard.
Thank you so much. So we're last slide here of the presentation. We're 3 minutes over. Stay involved in Florida's legislative process. We're going to have another follow-up legislative webinar, April 22nd, 10:30 a.m. We'll send you guys the invite to that in the next 24 to 48 hours. We'll get that out to you, and we'll get you more updates. And again, thank you to Dean Cannon of Gray Robinson, Robert, Chris, Bob Cortez, Representative Colleen Burton. Thank you to all of our attendees today. And let me close by just saying again, 2020 is over. 2021 now brings about an opportunity to try to move past COVID, get vaccinations out, and then help people in communities across Florida pick up the pieces of their lives. People are struggling with mental health issues, and they are dying in record numbers of overdoses, at the hand of overdoses and opioids. Stay involved, get involved in this work. We need you. You got to be a hero in 2021 that saves lives. And thank you so much for your commitment. We will get back to some of you who asked questions that we weren't able to answer, and we'll be back in touch with you on how you can help us partner around Florida to make a difference for those in need. Thank you so much.